At the same time, they're experiencing a shortage of nurses. So as West 2's Claire Metz reports, Halifax is offering a new opportunity to keep nurses and attract new ones.
It is very shocking.
Nurse practitioner Janine Waterman is on the front lines of the COVID crisis, caring for the pandemic's critically ill.
I feel like we should not be in this position. There are things that we could have done to prevent this.
The hospital typically employs 1,100 nurses, but they're down by 125 or so at a time they can't afford to be. A time when current staff is working round the clock, an exhausting challenge.
We're tired of doing this. We're tired of living in PPE all day long and going in and out of rooms watching some, heartbreaking things.
Part of the labor shortage, no doubt, is burnout, but officials say just as significant is pay. Staff is leaving to be better compensated as traveling nurses, and when that happens, the hospital then has to turn around and hire through an agency. So instead, they have created a new program offering in-house travel pay.
We'd rather pay our own team members than bring in those from the outside that we don't know. Our team members are loyal, they're staying with us, so we would rather them have the opportunity first.
The program offers $45 an hour if nurses commit to a fourth shift. So far, more than 60 have signed on, and officials are hoping the increase might convince those who are thinking of leaving to stay.
We want to pay our own team members what we would otherwise pay agency staff.
They're doing great work and they know what they're doing, and we hate to lose them because of finances.
COVID has put a strain on healthcare in general, while hospital officials here say they are coping. Attracting new nurses, holding on to current employees is key. In Daytona Beach, Volusia County, Claire Metz, West 2 News.
This afternoon, Halifax Health revised its visitor policy to try to stop the spread of infection. COVID patients may not have visitors. The hospital will work with families on virtual visits, and non-COVID patients can have 2 visitors at a time, although there are exceptions for extenuating circumstances.